everyone, and welcome back to Navigating the Periphery. My name is Deborah, and this is my handsome son, Philip.
Hello!
How is everyone doing today? If you're into what we're doing on this channel, please subscribe and hit that like button. We want to try and get our message out there and try to reach and help as many people as we can. Navigating the Periphery, we are trying to stop the stigma of a mental health diagnosis, one show at a time. If you know anyone who could benefit from watching this channel, please help spread the word.
Remember, it's okay not to feel or be okay all the time. You are not alone. We are here.
We are.
So, Mom, how are you doing today?
I'm doing great, Philip. How are you doing?
I'm good and excited to discuss today's topic. But first, a brief disclaimer here. We are not medical doctors.
No, we are not. Our channel is for information and educational purposes only. Someday I'll get that take right. And we are speaking to you guys out there from Philip's personal life experience with OCD, GAD, and schizoaffective disorder. So please refer to our full disclaimer at the end of this video and every episode that we put out. So Philip, take it away.
Today, we are going to navigate the periphery of how Lamictal has literally changed my life for the better. So this is a medication update episode with my schizoaffective mixed type. I have had serious bouts of depression since my psychosis in 2020. Recovering from depression isn't easy.
No, it's not.
One of the hardest things is that you just don't know what to expect. It's not like healing from an injury. If you broke your arm, your doctor could give you specifics about your recovery. They could tell you, at least roughly, how many weeks you would need to be in a cast and when you'll be healed.
Unfortunately, depression isn't like that. Each person's recovery is different. Some recover in a few weeks or months, but for others, depression is a long-term illness. In about 20 to 30% of people who have an episode of depression, the symptoms don't entirely go away, especially when it is co-occurring with another complex mental illness like schizoaffective disorder. You may also have trouble figuring out how you feel. If you have been suffering for a long time with it, you may not remember what feeling normal is even like. You need to know that you guys are not alone.
In schizoaffective disorder, depressive episodes are common, especially in the schizoaffective disorder mixed type. This form of schizoaffective disorder includes both mood symptoms, such as depressive and manic episodes, and symptoms of schizophrenia, such as hallucinations, delusions, and disorganized thinking. Patients often experience profound sadness, feelings of emptiness, or despair. This low mood can be particularly challenging as it overlaps with psychotic symptoms, sometimes making the depressive feelings seem even more overwhelming and unshakable. I have spoken about this in other episodes. It is like thick black smoke that is around you and envelops you.
As a parent, it's quite upsetting to watch. If you guys remember, several episodes back, Philip was taken off of Abilify, and he started taking Lamictal, the generic form being Lamotrigine. And I have to say, the improvement has been extraordinary.
Yes, Lamictal has been amazing, and I am astounded by how much it has helped me out of my depression. I feel I have been in the dark and fog for so long that I no longer know what normal feels like. But I am able to think clearly and am starting to enjoy the little things in life again. I really noticed it after our Halloween episode. Now, this is great for several reasons. The first being, Lamotrigine can specifically target depressive phases of bipolar disorder. Some people may find they need fewer additional medications, and this streamlined approach may reduce side effects. and improve overall medication adherence, which is a win-win.
Another benefit is Lamotrigine often has a lower side effect profile than some other mood stabilizers like lithium or antipsychotics. It's less likely to cause weight gain, sedation, or cognitive dulling. Most side effects tend to be mild, with the most notable caution around the rare but serious risk of a skin rash called Stevens-Johnson syndrome. Another win-win. Lamotrigine is also known to work well as a long-term preventative medication for depressive episodes. For people who have experienced frequent or severe depressive episodes, Lamotrigine's effectiveness over time can bring lasting relief and prevent the disruptive cycles of depression.
So in closing, I just want to say I'm feeling more balanced emotionally and in control of my mood.
Yes.
Yes. And feeling more in control of one's mood can lead to greater confidence and an improved quality of life. Many people report that they feel more like themselves when on Lamotrigine, as it can alleviate symptoms without dulling their personality or cognitive function, which is the third win-win.
3.
Overall, when Lamotrigine works well, it can be life-changing for people with mood disorders, allowing them to live with greater stability, functionality, and emotional balance. So there is hope, guys.
Yes, and seeing how well it is working makes me emotional. I am thrilled with the outcome. I want to stress it's so important to stay in contact with your doctors, especially when either changing medications and or dosages of medications, and that what works for one person may not work for another. But like Philip stated, there is always hope.
And remember, it's okay not to feel or be okay all the time. You are not alone.
And that we're trying to stop the stigma of a mental health diagnosis, one show at a time. So until we see you in our next episode coming really soon, have a wonderful evening and a great weekend. Take care for now. Bye.
Bye.